Here is another sample that I'll try to explain the structures, but a bit quicker this time. As you can see, this is the stomach, and here's the position of the stomach. This is the esophagus, the gastroesophageal sphincter. Here's the anterior surface of the stomach, and this is the posterior surface of the stomach. The lesser curvature, the angular incisura angularis. This is lesser curvature. This is greater curvature, and we said this is the fundus. Here's the body, the antrum, the pylorus, and this is the first part of the duodenum. And we don't say, maybe this is the pyloric sphincter, I don't know. The blood supply, this is the left gastric artery. Here's the right gastric artery. And here we have the left gastroepiploic artery. Here you have the right gastroepiploic artery, and if you put it here, you can see this is the, that's the celiac artery. Okay, the celiac artery. And you can see this is the left, this is a bit important, you haven't seen this, this is the left gastric artery. And if you put this one, you can see this is the left gastric, it ascends to supply the lower third of the esophagus, and then comes back down to supply the lesser curvature. Left gastric artery. Okay, and here you have splenic, note that we have this small segment is the common hepatic artery, then becomes hepatic proper, but we need this one, this is gastroduodenal. That becomes superior pancreaticoduodenal. We need this one. This is the right gastroepiploic, and you can see that it goes directly beneath the greater curvature. Right gastroepiploic artery to supply the greater curvature. Okay, so we talked about that. The diaphragm is cut off. Here you can see this is the inferior vena cava. Okay, let's say this is the stomach. This is the all parts of the duodenum. The first part, the second, third, and the fourth. Okay, this is the duodenum. It's supplied here. This artery is the superior pancreaticoduodenal. Also, the inferior pancreaticoduodenal comes from the superior mesenteric artery. Here we have the pancreas. This is the pancreas. It has the head, also the antennal process behind it. Okay, you have the body, neck. Neck, body, and tail. The pancreas, as you can see, goes to the hilum of the spleen. This is the spleen. Okay. This is the splenic artery. It has a tortuous course. This is the splenic vein. All right. This is the right kidney, the left kidney. This is the left suprarenal gland. This is the right kidney. You can see some papilla, 3 papillae over here. Yeah. Okay, and the pelvis. That's the pelvis. The major calyces, and then the minor calyx. Okay. The pyramids and the cortex. That's it. As for here, you can see this is, I believe this is the portal vein. Let's bring the liver. I believe this one is the, it's obvious. We said this is common hepatic artery. So this is the hepatic proper, which becomes this artery. To come here, we can look at it. We said this is hepatic artery, and this is the hepatic artery. This is the portal vein, and that's the portal vein. Okay, they are relating to each other. And here you have common bile duct. This is the common bile duct. Here, to see better, common bile duct, portal vein, hepatic artery. All right. Here you see this is the superior mesenteric artery and the superior mesenteric vein. Okay. For here, this is the level of the L4. This is the bifurcation of the aorta. These are the 2 common iliac arteries. Okay, they become the external iliac and the internal. I don't see that. Yeah, that's internal. This is internal iliac artery, and the continuation is the external iliac artery. Here we said this is the kidney. If you remember, this is the kidney. So this is the right ureter. Okay, and this is also the right ureter. Don't confuse this with this. This is the femoral nerve. This is the femoral nerve, which supplies the iliacus. And then let me bring the stomach, the kidney, the intestines. As we said, this is the duodenum. So here it becomes the jejunum. This is, if you put it back to here, you can see this is the DJ junction, the duodenojejunal junction. That's supplied by the ligament of Treitz, or the suspensory ligament. Okay, ligament of Treitz. I don't know. Nobody is talking about that. So here is the coils of the jejunum and the ileum. Here is the junction of the ileum with the junction of the cecum and the ascending colon. So here's the cecum. This depression is for the appendix. Okay, here's the larger intestine, ascending colon, and this is the right colic flexure, or the hepatic flexure, transverse colon, right colic flexure, left colic flexure, and here you can see this is the descending colon, and then becomes the sigmoid colon, which is here, this S-shaped, and then becomes the rectum to the anus. Okay. For the large intestine, you have two features: the house striations, which is obvious, and you have the tenicoli, 3 bands of smooth muscle. The tenicoli disappear at the rectum. Yeah, they continue until the sigmoid. It's obvious till here, and then at the rectum they disappear. And we said this is the sigmoid. This I guess this is the site for the bladder. What else is left? I know. Some say that this is a deep circumflex artery. I'm not sure if they have talked about this. You can ignore that. Anything left? I will try to talk about the midgut and the hindgut and those stuff. As you know, the foregut is supplied by the celiac artery, which is from the stomach until the second part of the duodenum, and from there until the distal portion of the transverse colon is called the midgut. That's supplied by the superior mesenteric artery, and below that, from here until the superior portion of the rectum, until there is called the hindgut. I don't know what's this. Supplied by inferior mesenteric artery. I don't know what's this artery, but for the blood supply, this was the model that I talked about. I said this is superior mesenteric artery, although its level is below this inferior mesenteric artery. This is a confusion. Don't be confused with it. This is superior mesenteric artery. Has the middle colic branch. Middle colic, yeah. Right colic. I don't know what okay, maybe yeah. This is middle colic. This is right colic, and this is ileocolic. And I don't know. This is supposed to anastomose here. We have talked about these. This is superior mesenteric vein, obvious. Inferior mesenteric artery, inferior mesenteric vein. Left colic, sigmoidal, superior rectal. I believe that's it.